Hi everybody, Dr. Hall here. We're going to go through the structures of the upper respiratory system. So here's my head on this model, nose and mouth obviously, and here's the other model as well. So from the external aspect of the nose, you can see the nostril, which we call the nare, N-A-R-E, nares is plural, so here's your nare. And then air is going to enter into this kind of entryway into the nasal cavity. So this is the nasal cavity here and here. Air is then going to move past these bony protuberances that stick out into the nasal cavity called the nasal turbinates. Think turbines. They spin the air around to help so that it can get warmed, humidified, and filtered by the nasal mucosa. Air is also going to move out into these little tiny openings to enter the sinuses. Sinuses are little caverns in the bones of our skull where the air is also going to swirl around, get warmed, humidified, and filtered. So this one here in the frontal bone is called the frontal sinus. This one in the ethmoid bone is the ethmoid sinus, and in the sphenoid sinus. We also have a maxillary sinus, which is out in the maxilla, but is not shown on this model. As air then comes in, nare, nasal cavity, nasal turbinates, it's going to move back into the throat. The fancy name for throat is pharynx, and we divide it into three regions. So first we have the nasopharynx, because it's the part of the throat behind the nose, then the oropharynx, because it's behind the mouth as an oral, and then the laryngopharynx, because it's behind the larynx, and we'll get to the larynx in a minute. A couple of structures of the mouth to know about. So the roof of your mouth in the front, right, you have the palatine process of the maxillary bone and the palatine bone. So that is the hard palate. And then we have some soft tissue, so that is the soft palate, which then ends with that little dingly down thing that you can see in the back of your mouth. That's the uvula. We can also see that on the other model, right? So again, nasal turbinates. We have our hard palate, soft palate, and way back hanging down in there, we have the uvula. So as air continues on its journey, it's going to move down through nasopharynx, oropharynx, laryngopharynx, and into the larynx, which is the voice box and the entryway to the trachea. We need to make sure that only air goes through here and not the Cheetos you're snacking on or that Mountain Dew that you just drank. So we need to make sure that food and liquids go back here into the esophagus, right? It's weird, our throat has to do double duty for both air, food, and water. So food and water has to go back here into the esophagus. To make sure that happens, we have a flap of cartilage right here called the epiglottis. Epiglottis. Epi means kind of above and outside of. Glottis refers to this opening. So that's the epiglottis here. So let's take a closer look at the larynx now, where the air is going to travel. So the epiglottis will be open when you're breathing, and air will move past these little folds of tissue here. Those are your vocal folds or your vocal cords. That's what allows you to generate sound. Those are anchored inside this big broad cartilage that you can see here and here, which is called the thyroid cartilage. I have a larger model of the larynx for you here. Let me get you oriented. This is that thyroid cartilage that you see here. This is the hyoid bone, which you see here, which is very high up in the neck. You might remember it from the skeletal system. This flap right here, that's the epiglottis that's going to keep food from going into your larynx and down into your trachea or windpipe. And then behind that, we see some kind of broken, but those are the vocal folds, right? Those are your vocal cords that vibrate so you can produce sound. So air moves down through the larynx. We have the thyroid cartilage here because it's located near the thyroid gland. And then we have the cricoid cartilage is the next one, and then we enter the trachea proper. The trachea has an interesting structure. It has these interspersed cartilage rings, and they help give structure to it, make sure that the trachea doesn't collapse on us. So we have those tracheal rings, and they're not going to be O-shaped rings. They're actually going to be C-shaped rings, because if you recall, behind the trachea is the esophagus. And most of the time the esophagus is closed because you're not eating and drinking, and that's fine. But if you're going to swallow a big mouthful of something, you need to have a little bit of give back here so that it can fit down the esophagus. So we have C-shaped rings that end posteriorly, because that's where your esophagus is, to give it a little bit of wiggle room for when you swallow something really large. So we've got the hyoid bone, the epiglottis, the vocal folds, thyroid cartilage, cricoid cartilage, C-shaped rings of the trachea. And that's it for the upper respiratory system.